All right. Welcome, everybody. I'm going to go ahead and get us started. Welcome to our Learn at Lunch session today. I am very happy to welcome Mikel Whittier, who is the Director of the Office of Health Equity, Diversity, and Inclusion for UCLA Health. Mikel has a vast experience advancing health equity and racial equity in healthcare settings. Like medical centers, state and urban public health systems, and non-for-profit hospital systems. His work has focused on quality improvement and systems transformation to progress access to quality, affordable care for various marginalized demographics. Prior to joining UCLA Health, Mikel served as the Senior Director of Equity, Diversity, and Inclusion at top-ranked academic medical centers. He is a proud volunteer in his community, participating on various boards, and is currently a doctoral candidate in business administration at Liberty University. Welcome, Mikel, and thank you for leading this discussion. I'm going to go ahead and turn it over to you.
Oh, no problem. Thank you. And thank you for the invitation. And I want this to be as informal as possible. And so as you all are eating your lunch, I tried to hurry up and eat lunch before I jumped on the call. But as you're enjoying your lunch, please feel free to just comment in the chat, or if any questions that you have as I'm discussing the things that I'm going to share today, just please feel free to just reflect on it and internalize it. I share that because equity and diversity and inclusion is such a personal journey. It brings into question your own worldview, how you were taught, how you were raised, the values you uphold, some of the consequences of the ideologies that we practice and uphold, whether it's our religions, whether it's the things that we practice in our communities, whatever the case may be. This work really brings those things into questions for various reasons, to really just help us grow, understand, but then also be in community with other people. And so I just really want to share what is healthy communities and what stake do we have as an academic center in that. And so I'm really going to talk through it through the lens of what we're doing in the Office of Health Equity, Diversity, and Inclusion. But I want you all to center your own selves in this, and how can you be advocates of this work? How can you be stewards of equity, diversity, and inclusion, belonging, justice from the places that you are leading? And when I say you as being leaders, all of you in some way, shape, or form are leaders, just not in your professional roles, but in your communities, amongst your friends and colleagues as well. And so with that, I'm going to share my screen. All right, if I could have hosts sharing.
Are you able to now?
Yes, thank you. And can everyone see my screen okay?
Yes.
Okay, perfect. So I'll just talk about what is equity in action and why are we here, and really get to how do we do this in a way that really brings out the best in the spaces that we exist in. And so starting with that is really, as I mentioned, why are we here? How do we get to this point? And I think there's a number of reasons why this work has been highlighted as much as it has over the course of the last year and a half. But there are several factors in there that I think are key catalysts. The pandemic is at the center of all of it. And it's created workplace hostility, violence, mental and physical distress of people, not only with the virus and COVID itself, but some of those tangential consequences. But then you think about what was happening socially. We see our Asian hate that was being perpetuated throughout cities and communities throughout the country. We look at the consistent discrimination and social injustices that play out in Black and African American communities. We see the inequities that have persisted for time with women. We see our LGBT community and the misunderstanding, myths, and stereotypes perpetuated there. And ultimately, what people want to do is break away from those things. They want an opportunity to be free of those things, to thrive, and just be their best selves. And so I really just want to talk through, how do we get people to a place of thriving? How do we get to this place where we really are in community with one another? And when we think about community in the earliest of senses, the earliest of times, community really was a reliance on every single person in that community in order to survive. And while community has evolved over time, how we rely on our neighbors, how we rely on the people to get around us to get work done, to accomplish tasks, that hasn't evolved as rapidly as we as a society has evolved. How we include people in our communities, what we perceive or don't perceive, and what we need and how we need to value them hasn't evolved over time. And so really that gets us to our work. What are we doing in our workspaces to create resilience and a community that is healthy and is thriving? And so there'll be terms in here that you may have heard before. If there's something that I need to pause, please feel free. I don't mind elaborating. But looking at these circles and keeping the pandemic in mind, what came into question throughout the pandemic? All of these things came into question, right? As we saw our community health and our ability to persevere come into question. And then we started looking at not only local political and economic factors, but geopolitical economic factors. We're a more global society now. And so we were looking at the implications of decisions of other countries and our neighboring countries and countries across the pond, and the decisions they make having implications on the decisions and the health and well-being of us here right within the borders of the United States. But then we saw the economic consequences, right? Those factors that really contribute to the collective well-being. But then when we drill down to more localized areas, the consequences of action and inaction on our community systems, our education system, our childcare system, our frontline services, right? The grocery stores, the essential services, all came into question, specifically with just the way in which we were navigating, and even just, are our systems prepared to respond to the climate we're in? And the answer was no. And so then we look at, well, can our infrastructure sustain all of this? And so you hear about the infrastructure spending, the infrastructure bills. Infrastructure is just not roads and bridges, right? It's the technological infrastructure, it's supply chain, it's being able to get the resources to community, it's making sure that our resources, our agricultural resources can go from farm to table as efficient as possible. And we're seeing inflation rise because of the lack of infrastructure. And so all of it is connected. All of it is connected in how we define community and how we define the ability to be healthy and thrive in communities, which ultimately brings into question what is happening so that the worst parts, the places in which we're getting the worst outcomes, are improved. And so I don't believe myself to be a DEI practitioner. I think that may be disrespectful to the people that have put life, time of research and work into this space, but I do believe of myself as a quality improvement and systems transformation practitioner. That's my background and my lived experiences, my passion within improving the inequities that we see in clinical care, patient safety, patient experience, workforce development. That's what allows me to connect the EDI to the reasons in which we have to improve these systems. And when we see these systems and the infrastructure developed and improved for the most marginalized in our community, everyone benefits. And in the case of COVID, what we saw was that the consequences of the gaps and failures of these systems were literally death, were literally the spread of misinformation, and literally was the epitome of unhealthy communities. And so I want to share a little bit more about how policy, how practices that you all can adopt in your spaces, whether it's community, whether it's in your workspaces, to drive healthy factors to healthy solutions and outcomes for the people you're serving and the people you're in community with. And so you may have seen social determinants of health. You may understand the consequences of zip codes and have heard all of these things before. But I really like this model with sharing this, because particularly what we see at the foundation of creating healthy communities is policies and programs. We know, or you may have heard at some point, that clinical care is only a small part of building healthy communities, and that's absolutely true. When we see healthy behaviors, when we see social economic factors, when we see physical environments and the impact that they play on someone's health outcomes, we also recognize that a lot of these factors are uncontrollable in health systems. Once folks leave the boundaries of healthcare institutions, it's really hard to drive equity. And so when we think about equity and how we strive for excellence in equity, it really is, it takes all of our systems. It takes our academics centers, it takes the innovation and the research that happens there, it takes the emergence of the future leaders, it takes the individual people to help proliferate their own families out of tough situations, first generation, master, college, undergraduate students, whatever the case may be, that we see just the most minor decisions or lack of decisions that we make in our roles as leaders in our communities could impact the health and well-being of an individual, of a family. And it's all rooted in our ability to either adopt the policies, put policies into action, or put programs forth. And policies, this is a bit of an ambiguous word because we talk about policies and politics so robustly. And how I like to think about policy is that everybody contributes to policy. Policy is folks working together to ensure communities can have enduring well-being and thrive. And that's either done through an administrative act, legislation, a voluntary act, a formal policy from people, from groups of people and institutions and communities, or even legislators and government. And so everybody does policy. I guarantee you, all of you in your space at some place, at some point in time, have done something to help improve the efficiency of your work and to better serve the people that you're serving. It's almost impossible to work without taking that mindset. It's not taking corners. It's not shortcutting anything. It's like, hey, there's a flaw here, and it's my responsibility to fix it or navigate it to help better serve the people I'm serving. And so that's what policy is. And that data, those data points, help derive macro level policies. And ultimately, the things that we're doing and we're shaping with all the data we're gathering and all these different things in places help us get to healthy outcomes that improve the quality of life for the people we serve, but then also the length of life when you think about it from a healthcare perspective. So I want to share a little bit more about the Office of Health Equity, Diversity, and Inclusion, particularly because the work was really formalized out of the context that I just shared. I've only been in my role, I've been here at UCLA Health since the end of June of 2021. So I'm still relatively new, having hit the year mark. And so there's a lot to learn about the organization we exist in. But what I do know is that there's a strong appetite to advance equity, diversity, and inclusion from our students, from our trainees, from faculty, but then also staff all throughout the organization. And so with that, when we established the mission, vision, and values for this work, we really wanted to make sure that we create and advance a healthcare system that achieves optimal well-being and health. But as you see here, it's not just for our patients, but it's for our staff and our community. I keep mentioning community because our staff, our faculty, the folks here at this institution are the biggest marketers and advocates for the service we're able to provide as a health system. Similarly, as an academic institution, we are the biggest recruiters for students and trainees and research and funding. And so for us, we really wanted to be a premier leader of inclusivity, justice, and equity in healthcare. And why we want to do that, I'll point to some literature at a high level. I won't dig into the details, but what we know is everything about equity, diversity, and inclusion is connected to a business case. But in order to do that, we have to hold ourselves accountable. I'll come back to this value of accountable. We have to talk about service and serving others. And you've heard me mention that a couple of times now, but we have to be in partnership. There's a lot of intersectionality here. We can't conflate our differences as if we understand the experiences of people. And that's why we have to be true partners in this work. A lot of folks like to talk about allyship. I like to talk about being an accomplice. That has a negative connotation to it from a legal perspective. But when you look at being an accomplice in good trouble, and good trouble coming from the late great John, I'm drawing a blank. Why can't I think of names right now? But nonetheless, thinking about good trouble, excuse me, that's going to come to me later. It's going to bother me. But thinking about just being in a true partnership and being and serving in a way that we could drive excellence and be courageous and courageous acts, being able to speak up when things may be difficult to speak up upon, when we know that the people that hold and possess these powers are people who with strong reputations, who are doctors, who are well renowned, who are the best innovators, but being able to speak up and tell people when they're wrong, that takes a lot of courage. But then lastly, transparency, being able to be transparent in this work, being able to really share that, hey, we are not where we need to be, we are not where we want to be, but we are working to get there. That's tough to do as well as an academic system that thrives on excellence. So we have to really call these things out and really work towards them. And again, as I mentioned, be a partner in good trouble with this. And again, in the spirit of John Lewis, it came to me, that was going to bother me. It's just amazing in which we can drive our values and the basic behaviors that we all could agree upon to create that culture of inclusivity. And so these principles that I shared a little bit about, we know that the evidence and the data points to better healthcare and better service for our patients. When we see the top performing 500 companies in the world, the most diverse across race, gender, ethnicity, nationality, sexual orientation, are the highest performers as it comes to earnings before interest and tax and paying off debts. And similarly, in healthcare institutions, we know that the most diverse leaders amongst healthcare institutions, in addition to boards and making sure the most diverse set of voices are heard, help us better serve the diverse patients that we see. And so including those voices in our process allows us to create and foster an environment of not only inclusivity, but improving upon those outcomes. And then also greater productivity. We know, I think the Great Resignation is a hot topic right now. And we see that EDI, core values, alignment with one's values is a huge part of why people are resigning. And so fostering an environment that supports greater productivity, innovation, and engagement is really derived from creating a space of inclusivity and belonging. And a lot of people like to talk about psychological safety without the other psychological or the other components to engagement. We have capacity, psychological capacity, the ability to even emotionally do the work. That availability is a huge part of it. But then also the meaningfulness, psychological meaningfulness. Is this work meaningful for you? Is the work that you're doing meaningful? And so you can't even completely engage in work unless it's meaningful, unless you have the mental and emotional capacity, but then also you have that safety. And I talked about the courage a little bit, but even breaking it down at a psychological level, when you look at for example, Maslow's hierarchy of needs, at the very base of that is we need to feel safe. And fear in spaces where we don't feel included, where we don't feel our voices are heard, results in us being shrinking ourselves in times in which we shouldn't. And more times than not, that's times when we see discrimination, inequities, injustices, because we are vying for our own safety first. And that doesn't create inclusive environments. And so that's why it results in greater productivity. But then we look at, we are doing this to really build relationships. As I told you, partnership is huge. We can't provide high quality, equitable care without being in partnership with our communities, without including patient and community voice in the process, student and trainee voice similarly. And we have to embrace this work. Anti-racism, anti-bias principles are non-negotiable as we're seeing the world evolve around us. And we have to embrace it, we have to integrate it, and we have to make it make sense, reduce the fear and anxiety around it, and simplify it, and just make sure that, hey, if we have shared values, we can get to a place where we are embracing anti-racism and anti-bias. And so I want to share some frameworks in which we can address some of the more difficult conversations and the more difficult processes that really prohibit us from moving to action. And first is, I really want to point out that we cannot exist in a world where we act as if these problems don't exist. Being in community also is the realization that we all are different. We all have different perspectives. We all have different worldviews. We all have different religions, faith, values, etc. And in community in the workspace, we have been taught to be robotic, in the sense that when you come to the workplace, you are told to turn off your worldview as it pertains to religion, faith, sexual orientation, your politics, all these other things. You're told to turn those things off. But the reality is, those things are what help you shape how you solve problems, how you mediate conflict, how you manage interpersonal relationships in the workplace, how you work in a team, etc. And so to turn those things off is to say, hey, I'm going to turn off my humanity for the sake of this company. And we know that that is not a reality, but that has what has been taught for quite some time. And so with that, you have to pay special attention to the informal components of an organization. So you have the formal structures that drive the operations, that drive our KPIs and our outcomes, but then there's also the social context, the informal. And the formal cannot exist without the informal. And a nasty part of the informal aspect of organizations is the racism, bias, and microaggressions as we know them. And so we have to be sure to acknowledge those things and be aware of them, call them out, but really just understand how to identify them. And so, with that, some of the biggest ones that play out in our organization are interpersonal and institutional bias and racism. Yes, there's systemic issues, there's the intrapersonal beliefs as well. But what we see most dangerous, that is most dangerous, is that interpersonal stuff that really results in the bigotry and the racial slurs and the jokes and the microaggressions that we see. And these have consequences that extend to the mental health and physical well-being of the people that we are in community with. It affirms stereotypes. We see it all the time, and allowing for microaggressions to exist and not call them out reinforces those stereotypes. But then also, some of these things affirms, or rather assumes, sameness across demographics. We know that if you just look at your household, your family is diverse. And so to assume that all people of a similar genetic makeup or nationality or religion are all the same is just completely ignorant. And so ultimately it hinders our ability to get to a more diverse, inclusive, and equitable place that creates that sense of belonging. But the other side of that is one thing I also want to highlight is the internalized racism and bias. Sometimes we internalize and accept, excuse me, we accept some of these stereotypes, and I'll share examples of it. As a Black man in America, I have been told that I have to work twice as hard sometimes. And you and your experiences may have heard the same thing in various arenas. Well, working twice as hard to get the same outcome as the status quo, that doesn't reinforce excellence. That reinforces that I must burn myself out. I must physically exhaust myself in order to get the average outcome. Not excellence, the average outcome. And so when I internalize some of these negative stereotypes to work harder, it has, again, mental and physical consequences on my well-being. And so that's one thing we must call out as well, as if we don't call out the racism and bias and microaggressions as we see them in the workplace, what we begin to do is internalize those things unconsciously that still has negative consequences on our social environments in our workplaces. And so we must be intentional in our action. When we see these things, we must take them for what they are, as their discrimination and bias in the workplace. They occur. When we look at challenges and concerns, they must be addressed. We must do it with intention, whether it's in academic settings with our researchers and labs, or with faculty and our educators, or whether in the health setting where we're really what we're really doing is trying to create safe environments for our patients, families, and our staff. And safety is huge in healthcare, as we know. And so we have to be just as intentional, because this neglect of our social environment within our organization is just as dangerous as those safety episodes. And so using appropriate frameworks, helping people understand that we're talking about quality improvement, the quality of interactions, the quality of workforce development, the quality of education and training we're providing to our students and our trainees, to our staff, also to our patients, are important to promoting not only the safe environment, but getting us and moving us to those outcomes we're desiring. And so I want to share five A's, which is a framework in which we work in to move to action. And so I talked about awareness, right? Being aware that racism and bias is just an inherent part of people being in community together. It's the most ugly part, and we like to ignore it, but it is the reality. And we have to acknowledge it. We can't ignore it. We have to recognize that this is where we are, Some of it is uglier in some places than others, but it does exist, and we need to recognize it and deal with it in order to improve. And that helps move us to action. And so if we acknowledge it, we're collecting data. We have information, whether qualitative or quantitative or anecdotal in nature. We can use that data to inform strategic action, to what we prioritize and how we get to improving the outcomes that we're seeking. And as I mentioned, that accountability has to be shared. It has to be ownership of this work all throughout the institution. It can't just be top leaders speaking it and saying we need to move these things into action. And it can't be our frontline staff, our students, the folks with the least power saying we need to move these things into action. It has to be everyone accountable and owning this from their places within our community. And then lastly, we have to put an emphasis on achievement. We have to understand that we are a academic medical or the health system is an academic medical institution, but the entire campus is a place of learning, and learning doesn't stop, nor does improving stop, because we are constantly evolving our knowledge, we're innovating in places, we're researching and uncovering new information in places that we fortunately get to put into practice. And so that's where that achievement and striving for excellence comes in. And so what does collective action look like? What are some things that you all can do right now to really advance equity, diversity, and inclusion in your spaces? And it can be really simple. We don't have to overcomplicate this. The GROW model is a form of collective action that is derived out of organizational development frameworks. And what that really says is just, what is the goal? What are you trying to accomplish? People say, hey, we want to create a more equitable, diverse, and inclusive space for everybody. But what does that really mean? And so understanding where you are and or first setting a goal and then really understanding where you are with that goal is important and absolutely imperative. So it gets us back to the awareness and acknowledgement. But then we look at what options are before us to advance this work. And embark on this journey? What are the possibilities? What are the opportunities? And even where are some limitations, right? And so you see SWOT analyses and all these different things done in places, but it can just be as simple as asking a question. And then what are the ways in which we can move forward? How do we wayfind, and what will we commit to doing to ensure that we can achieve this goal? And that is as simple as it gets. And so I share that GROW model because you could take it and use it amongst your teams immediately. But then there's the interpersonal aspect of it, and really, how do we gather the courage to speak up? And the reality is, not everyone is going to have the courage. And that's where I said being an accomplice in this work is so important, because sometimes allyship really hinders our ability to be true upstanders. It's like, all right, I'm going to support you in your action, but sometimes being an upstander or accomplice takes it a step further with respect to the wishes of people that are victims of discrimination. But if you're a victim, or rather you're a bystander of discrimination and bias, the first thing we want to do is just gather ourselves. It is easy for us to emotionally respond to situations. I know I wear my emotions on my sleeve. I have the privilege as a cisgender heterosexual male in places and spaces, and I recognize that. But not only that, my position allows me the privilege to speak out with, for the most part, no impunity to call people out. And how I choose to do that, where I choose to do that matters. But gathering my emotions when I see it happen first is so important. Next, restate. Did I hear, see what I think I saw or heard? And making sure that you inquire about it. Ask, like, hey, did you just say this? Did you just do this? Is that what I think I saw? Is that what I think I heard happen? And then talking it out. And maybe it wasn't the intentions, right? You get to that intention, that intent versus that impact. And maybe it's as simple as talking it out. Maybe it's not as egregious and you just talk it out, it's a misunderstanding. But then some things can't be talked out. And that's where being a mandatory reporter, making sure we report whether it's harassment, sexual violence, discrimination, bias of any sort that creates and reinforces unsafe work environments for staff and trainees and students, because in California law, that's actually illegal. So with that, it's important that we at least have some frameworks we can work within to build and practice upon these skills to just say, hey, like, we can't tolerate it. And so we're going to practice and get better at calling these things out. And so excellence and equity, I just want to share some things that we're doing within our office with the School of Medicine to ensure that we're educating and building the skills and what are some things that can be adopted. And so at the very basis, we're working with toolkits and resources to help our staff just if they want to explore and gather resources to learn that they can. Main campus and the leadership of Anna Spain Bradley has been phenomenal with gathering resources for us to really do this work on our own. But then when we look at specifically the healthcare system, we developed an online training to help people walk through what are we talking about when we talk about these issues in respect to healthcare settings. But then we want to get to more contextual models, more advanced models where we can apply this in different spaces. And then ultimately really make sure that there is a professional development mechanism where leaders can integrate this, understand the business and management practices connected to equity, diversity, and inclusion that ultimately helps create better leadership and team development across the system. And so how we connect that with the School of Medicine and the Office of Justice, Equity, Diversity, and Inclusion in the School of Medicine is connecting our values with CI Care and our cultural North Star with our organizational mission, vision, and values, but then also connecting it to our professional standards, our faculty and staff development, our education redesign. We're in the midst of redesigning our medical education with a cohort of leaders, but then also how do we train and educate and coach our teams and our leaders across the system, ultimately to build an environment that fosters and reinforces the values of equity, diversity, and inclusion in action rather than just saying it in word form or in performative nature. So that's really the work in a nutshell, how we are moving into action. But then also those are things in which that I feel can be adopted in any place and some frameworks that have worked in the most toxic of places. But then also in the most collegial of places as well. And so I appreciate you all having me here to share this with you. I'd be happy to answer any questions you all may have or discuss anything that I've shared with you today.
So feel free to go ahead and unmute if you have a question, or if you are more comfortable putting your questions on chat, I can facilitate that for you.
And thank you, Hilda. I just saw the comment, John Lou. I just had a complete brain lapse. So thank you for that.
Questions? I'm trying to look for.
I'm okay with no questions. And so we got a comment just come through. And thank you, Angelica, for your comment here. And I think this is one that has been at the forefront of not only the health system, but main campus and actually UCOP as well, that we want to make sure that we can put appropriate measures in place to follow up on discrimination complaints. And so the entire system is being transformed in real time to hold leaders accountable for follow-up. And so there are spaces in which leaders would say, I never even knew a discrimination complaint happened. I never even had the opportunity to address it because I didn't have insight into it. And so that excuse is no longer. And we're working to address that, at least in the health system side. And I know there's being work done all the way up to UCLP to really address that issue. And so that's a very good point. And we want to make sure to ensure that HR isn't in it alone, that there's an environment conducive to support HR in these processes as well, because it can be a little bit overwhelming.
I see another question. Michael, what metrics do you use to measure your initiatives?
So the metrics are really contextual. And so it would really be predicated on what KPIs or outcomes measures that you all have that you're using, and then putting an EDI lens on it. And so it's easy, for example, to look at clinical measures. And so we look at clinical outcomes, we layer our patient demographics on top of those, and just really benchmark from there. And so we have to do an intentional job of making sure that our data that we gather from our patients as it pertains to demographics are accurate, so that we can look at it and stratify it in a way that really allows us to have an honest and clear picture of what is going on and say, all right, these are the things that we can target in order to improve quality there. And so I don't think that there is abstract measures, especially as it pertains to workforce development. As we look across the workforce, we know that there's pay inequities. We need to address pay inequities. When we see the lack of representation, for example, in the hospital and health system, we know for a fact that our Hispanic and Latino community is not represented in our senior leadership the way it's represented at frontline positions or throughout the greater Los Angeles area. That is problematic. We don't need abstract measures to tell us that. We just need to put things in place to ensure that we are gathering the most diverse pool of candidates. We are reaching out to associations and professional groups to share job descriptions and being intentional about our recruiting efforts. And so those are just two examples. And so I would say, instead of thinking about it in a complex way, it's like, what can we measure and what are we currently measuring? Where does our data exist? What are those potential gaps in that data? But then also just layering that EDI lens on it is how can we improve outcomes if we start to really deaggregate that data by race, ethnicity, gender, sexual orientation, et cetera.
Great, thank you, Michael. Another question is, can you please share some possible ways to create or build shared accountability?
Yes, and so this is something that is a priority within the health system as well. And first is that shared ownership. And so integrating EDI into goals is critical. It should be non-negotiable, right? As making sure that we can move it. And again, it's going to be contextualized to whatever teams you're working on and whatever you're doing, but making sure that there's at least one goal that says, hey, we need to improve X. And we're going to do that over the next year. And this is going to be connected back to the performance evaluation. We know that if we connect equity, diversity, and inclusion back to our shared values and those behaviors, or what we call our organizational culture, then that also should be a part of how we evaluate you and your work. And so owning that and taking it and really driving that from the spaces you are in is the best place to build accountability now. But then looking at what are those formal structures. And so as a leader, you can say, all right, we're going to voluntarily make this a part of our goal setting and our evaluation process, but we're going to work with other leaders to formalize that. Is there an opportunity in which we can make that a measure and make sure that promotion, any type of pay bumps are predicated on your ability to be a part of this mission and vision to make the workplace more equitable? And it's interesting to see how people move when things are connected to their pay, when money is connected to it. And so that's one of the easier ones, but also ensuring that people recognize the significance of this. And so I shared its interconnectedness to our organizational values, but making that very concrete for people is another way that can be done. And I'll give you an example. One of my first presentations to a department of directors, I had a leader of color tell me that they don't feel like it's their responsibility to advance equity, diversity, and inclusion. I said, okay, I understand the sentiment, I respect it. However, my question back to that individual was, is it your responsibility to uphold and perpetuate the values of this institution? And I asked the entire group that, and everyone said, yes, it's my responsibility. And so when we think about creating spaces where we can better collaborate, where we can help reinforce places where people can maximize their potential to be their best selves and show up, whether they're learning or whether they are leading or whether they are doing the work, that is part of the values of the institution at its very bare form. And so that accountability to equity, diversity, and inclusion is not an accountability to that specifically. It's an accountability to upholding the values of the institution. And that's a big part of our work, is explicitly laying out what are those professionalism mandates, what are those behavioral things that we must explicitly lay out. And so we're working on that right now. So people, instead of taking the negative approach, we center the positive behavior. So what does creating belonging look like? What does a respectful workplace look like? And if you're not upholding that in its most simple forms, then maybe this isn't the place for you. And so that's how building community works, is agreeing on what those shared behaviors and values are and committing to upholding those. And that's non-negotiable. Everybody agreed to uphold the mission, vision, and values of UCLA and the UC system. And so I think just starting there in the amongst your teams is a great way to build that accountability, but then formalizing it and embedding it in the structures that you as a leader have control over in an involuntary sense is a way to do that as well. And whether that's as a department or whatever the case may be. And so that's why I mentioned policy was so important, because taking that step is a form of reforming policies. And the more people that adopt those practices, the more formalized that can become, all the way up to the point where it could potentially be revised or a policy change at the UC level. And that's basically grassroots efforts at its finest.
Thank you. That's great.
Yep. Jen, it should be known from the onboarding. I think it should should go a step before onboarding. I think in the recruitment phase, people should know and recognize the values and behaviors of our institution, and they should also feel the courage to ask questions. Is my identity going to be a hindrance of my ability to be in a space where I am thriving, where I can reach my potential, where I can develop and grow? Because ultimately, that's what we are here to do, is grow and learn and be our best versions of ourselves. And so in the recruitment phase, I think sharing those values and letting it explicitly be known, whether it's in our job descriptions or on recruiting services, whatever the case may be, that it should be widely known. And brand equity isn't the only way that we can market ourselves. I think that there's a lot there as well.
Great. This has a question. As a member of a minority group, it can sometimes feel emotionally taxing to carry the burden of educating while already experiencing acts of discrimination. How do we give these situations new energy to become active participants in the change we desperately want?
That's a tough one, because the emotional fatigue, the physical burden doesn't end. That's utopia, unfortunately. But what we can do is help orient our colleagues to a point where they need to, again, going back to those 5 A's, be aware and acknowledge these things, but understand that, hey, it's our responsibility to improve these things. We can wait on a statement from the most senior leaders in our institution, or we can exemplify and put into practice the behaviors we want to see right away. And putting those things into action in your sphere of influence is the biggest step you can take immediately. I give the example of when anytime there's any social unrest, it takes a league of or a group of outside consultants, marketing, comms, government relations, and a group of leaders in a room to put a 140 character statement together to say we stand against injustice. That's a lot of money spent to just say we stand up to doing the right thing for the people we serve. And so thinking about being a part of those processes and those conversations, it's emotionally draining just even sharing that, because it shouldn't take all of that. It should just say, hey, we stand against this, we support folks, we stand up for justice, and that's it. There's no gray area with that. And so that reality isn't going away. I wish it could go away immediately, but the best thing to do is to really make sure that folks are aware and acknowledge the reality of where we are, and make sure that there is consistent effort to improve. And that's why continuous quality improvement, continuous learning, and self-awareness and situational awareness are so critical to this work, because those things are non-negotiable in terms of advancing equity, diversity, and inclusion. And so I really hate it. There's no real better answer there, but until we can really have a community that reflects the values that we have here, it's going to be tough. And I could be more than happy to share this presentation with you all, just as we're winding down. And I see Sergio has a question. How do you think the atmosphere of inclusive and diversity has improved or degraded during COVID with more Zoom and less in-person gatherings? Technology is a gift and a curse. I think technology is beautiful. It allows us to connect easier, but those social cues begin to diminish a little bit. Body language, being able to connect and really express ourselves fully is diminished. Being able to be one with people has diminished. And the biggest issue here that I see is what we see in social media spheres is bullying and attacking. And we act as if folks aren't human or they're detached from the things that we're saying. And that creates problems. And it's very toxic if it goes unchecked. And it's how are we leveraging our technology and Zoom in order to build community rather than create barriers. And so I believe that it has created problems because it's desensitized people in a way. You're able to work and not be fully engaged. I think everyone here, and not to call you all out, but you're probably doing something right now as we go through this. And there's no problem with that because it's a lunch and learn. But just think if it was a meaningful conversation for me, or if I was expressing a discrimination, a complaint, or a problem I had, it would be truly problematic. And so it turns off that engagement and that compassion and empathy through connecting with people. And that's basically the humanity and community. And so that must not get lost in our reality of technological advancements and how we leverage technology. But we also have to recognize that a part of humanity is lost the more and more we detach and not be engaged.
Thank you.
And I see another question here about tracking turnover data. And yes, our department, we've worked with HR and other departments to build out an HR dashboard to really get better at tracking this information. And while it's not live yet, we're working through the kinks and making sure the data is accurate, making sure that the legal ramifications of that is all sorted out as well. And so there's a lot of work to be done there as a public institution, but what we are ensuring is that the well-being of our people is centered in every decision that we're making. And I can assure you that our chief Health Equity, Diversity, and Inclusion Officer is a fighter for justice, equity, diversity, and inclusion, and same with our Dean of Justice, Equity, Diversity, and Inclusion in our School of Medicine, Dr. Dave McIntosh, and Dr. Mikel Briggs-Melanson. And so with that, their persistent leadership is to ensure that our data reflects the decisions we're making and that we're not coming into rooms and doing things based off some anecdotal data or because someone doesn't want to do it. And so with that, all of our decisions are being made on data. And as far as investments as it pertains to EDI, we're making sure that we are being deliberate with those investments. And so within the health system, we, as of January, became a health anchor institution, a part of the Health Anchor Network, which is a network of academic medical institutions, hospitals, and other health systems throughout the country that are advancing equity, diversity, and inclusion as it pertains to procurement, as it pertains to community engagement and investing, as it pertains to workforce development, recruiting, and other processes like contracting and such. So there's a lot to be done. These systems were not made for what we are trying to do, and that's the reality. These systems were founded on white supremacy and segregation, and that's okay. None of us are at fault. We are not the reasons why these places were founded. However, it is our responsibility as leaders to transform them to make sure they meet the needs and requirements of future generations. And so with that, it's going to take as long as it took to get an institution to this level of recognition, is also going to take just as long to transform it, to really make sure that our system is what our future generations of folks needs. And I'm not talking about our kids or our grandkids. I'm talking about hundreds of years from now, 200 years from now. What does that mean? Are the decisions we making right now going to be the best decisions long-term for our communities? And that's the questions that we have to answer and reckon with.
That's so great. Thank you so much, Michael. This information is just so important. And we did record this, and we will share this with everyone. It'll be in the Staff Assembly website. Michael, if you don't mind sharing your presentation, we can also upload it to the website. You can send that to me at any time.
Okay, awesome. And then I'll also share my contact information in the chat, just so you all have it. I know that I'm learning the domain differences
Yeah.
across the organization, so I don't want to assume everyone knows the emails, but I just put my email in the chat. Please don't hesitate to reach out. As I mentioned, we're partners in this work. I know that there's a lot I can learn from you. As I mentioned, I've only been here since the end of June, and so there's so much more I need to learn and understand. And to the question about Zoom, Sergio, I've existed in a Zoom world for the last 8 months, and I'm constantly meeting people that I've worked with for the last 8 months in person for the first time. And so I just love being in community with folks and partnering and learning. So please feel free to reach out if you all have any questions. I'm an open door all the time, and we can always set up some time and talk through these things.
Great. Thank you so much. All right, everybody. Thank you for attending. We'll give you all the information in the Staff Assembly website. Thank you. Have
All
a
right.
great day.
Take care, everyone.